for 202, 99202, we need 20 minutes in prior to 2021. In 2021, there is a range from 15 to 29 minutes. So any time between 15 to 29 minutes, which belongs to 99202. Okay, coming to 99203. So in 2020, it is like 30 minutes, a definitive time, a fixed time like 30 minutes. Coming to 2021, there is a range from 30 to 44 minutes. Okay, going to 99204, which is required 45 minutes, but in 2021 there is a range from 45 minutes to 59 minutes. For 99205, there is a 60 minutes in 2020. Coming to 2021, from 60 to 74 minutes. So any time between 60 to 74 minutes is applicable for 99205. Okay, so time for established patient. Yes, time for established patient. Same, the time reported is the total amount of the non-face-to-face and face-to-face. So different activities which comes under face-to-face and non-face-to-face, both combined together, and the total time is reported. So 99211, 5 minutes is required in 2020, but in 2021, no long time is required. So we are not going to assign 99211 with based on time. Okay. For 99212, 10 minutes is required in 2020, but in 2021, it is from 10 to 19 minutes. Okay, any time between 10 to 19 minutes, we can assign 99212. So 99213, 15 minutes in 2020 and 20 to 29 in 2021. So for 99214, 25 minutes in 2020, whereas in 2021, from 30 minutes to 39 minutes. Okay, going to 99215, it is like 40 minutes in 2020, and in 2021, it is a range from 40 minutes to 54 minutes. So if you can observe, for each level, there will be a minimum threshold time to meet that particular level. Okay, so there is a minimum threshold and maximum threshold. So the range between these particular time is applicable only for the particular level of service. Okay, so with this, we completed code selection based on time. We already completed documentation changes. We already completed code selection based on MDM. We already completed code selection based on time. Now we are going to discuss about some new concept. Actually, that is not a new concept, but there is a change in this concept. So that is the reason we are going to discuss in this particular session. So prolonged services. So we all have some interest if you get pay extra beyond our regular payment. So that is the reason we can work some extra hours to earn some money. So yes, physician also interested to earn some extra money if he spends some more time to spend on a patient care. Okay, so extra time equal to extra money. That is nothing but prolonged services. So when we can consider prolonged services, the usual time should met. After that only we can consider as prolonged services. It is just like a extra hours or working on a weekend. Okay, yes. What are the changes in prolonged services? So we all know there is a separate code set for outpatient prolonged services and inpatient prolonged services, but we are not going to use those codes for office visits in 2021. Okay, for 99205 and for 99215, we are going to use a new code, which is 99417. Okay, so the criteria also change. So what is that? We'll have a look. When the total time exceeds the highest level of service, so there will be a one threshold time point for each level, but we are not going to assign 99417 for each level. We are going to assign only for the highest level, which is 99205 for new patient, 99215 for established patient. Only to these two particular codes we are going to assign this new code 99417 when there is a threshold time of 15 minutes. Okay, here they are giving highest level exceeds of service plus 15 minutes. What is the highest level of time that we'll have a discuss plus 15 minutes. So together is considered to code 99205 plus 99417 or 99215 plus 99417. So we'll have a look. So you would report code 99417 in addition to the applicable office visit codes. Okay, so we know, so there is a separate set of code for prolonged service for office visits and for inpatient services as well. So we have two codes. So one code is applicable for 1 hour and add-on code is applicable for each additional 30 minutes. But in 2021, so only single code is applicable for prolonged services. That too, only 15 minutes is required to assign new code. Okay. Yes. So the previous codes we can use for some other services which we are coding, but not to the 99205 and not to 99215. Only 99417 is required to append for these two codes. Okay, so point we need to remember, use 99417 in conjunction with 99205 and 99215 in 2021. Do not report 99417 in conjunction with 99354, 355, 358, 359, 415, 416. So we are not getting much about these codes. Okay. Do not report 91417 for any time unit less than 15 minutes. Okay. So we cannot report 99417 if the prolonged service time is less than 15 minutes. Okay, so what is that, how we need to calculate, we'll have a look in next slide. Okay, so we have a separate calculation for new patient and established patient. So we are not going to assign this 99417 for all the levels, only for highest level. If we consider established patient, what is the highest level? 99215. So to code 99215, what is the time required? 40 minutes. Okay, if physician documented total time, it includes both face to face and non face to face. So the total time, if physician documents 40 minutes, then we can assign 99215. So then why is 54 required? From 42 till 54 minutes, we are going to assign only 99215. We are not going to assign prolonged service because so the minimum threshold time of 15 minutes is not met here. Okay, so the minimum time to assign 99215 is 40 minutes plus 14 minutes. So here the minimum requirement to assign 99417 is not met. So that is the reason from 40 to 54 minutes, we can assign only 99215. The moment when the prolonged service is entered into 15 minutes, then 99417 will comes into picture. Okay, if any time between 55 to 69 physician is documented, then we can report 99215 into one unit and 99417 into one unit. Okay, from 70 to 84 minutes, we can report 99215 into one unit and 99417 into two units. So like so on, for each 15 minutes, we can report 99417 into as many 15 minutes time documented by physician. Coming to the new patient, so the highest level will be like 99205. To report 99205, the time required is 60 minutes. From 60 minutes to till 74 minutes, we can assign 99205 only. From 75 minutes till 89 minutes, we can assign 99205 into 1 and 99417 into 1. Like that, for every 15 minutes, we can assign a new prolonged service code like 99417 only for these office visit codes. Okay, 99205 and 215. Only to these particular two codes, we can assign 99417 if the prolonged service will meet the minimum threshold of 15 minutes. Okay, for each 15-minute time criteria, we can multiply 99417. Okay, so I hope I'm making sense regarding this prolonged service. So we need to remember 99417 is applicable only for 215 and 205. That too, if it is met for 15 minutes of prolonged service documentation. Okay, yes. So we'll have some look in a code description change between 2020 and 2021. So revised prolonged service code description prior to 2021. So what is effective 2021? Yeah, the code will be same 99354, 99354. But only thing that we need to focus on required direct patient contact. So which is not documented in prior to 2020. Okay, and the revised code description, like list separately in addition to code for outpatient evaluation management or psychotherapy service, except with office or other outpatient services. So we cannot use 99354 for 205 or 215. Okay, so for these particular codes we have a new code which is 99417. Only for 15 minutes time we can report this. Okay, this is an add-on code. So these are a regular codes, and we all know this comes under outpatient prolonged service, but we are not using for the office visits in 2021. So just discussed because of there is a change in code description. Okay, yes, coming to the next set of codes, revised prolonged service code description for 99358 and 99359. So these codes are used for other outpatient services but not to the office visits, except office or other outpatient services. So we are not going to use this 99358 and 99359. Okay, can be added on a date other than the date of a face-to-face encounter. So reporting using 99202 to 99215. So we cannot add together with these office codes, but we can report after the encounter date. Okay, for prolonged time without direct patient contact on the date of office or other outpatient service, we can use 99XXX, which is 99417. Okay, yes, so we are no longer using this 99358 or 359 with office visit codes. Okay, 99359 is a add-on code for this particular set of codes. Okay, so we'll just have a look about a glimpse what is a revision in prolonged service guideline. Okay, so code 99417 will apply only if the primary ENM code is based on time. Okay, so either 99205 or 99215 should be based on a time only, then only we can consider to assign 99417. Okay, if the level is assigned based on MDM, then we are no need to assign prolonged services. If the level is just based on a time, then we can assign 99417 if time exceeds beyond the usual regular service time. Okay, the new code will include with and without direct patient contact. So 99417 we can append along with regular ENM service when there is a direct contact, patient contact with and without on the date of service. Okay, use 99417 once for each 15 minutes beyond the primary service time. For each 15 minutes time we can multiply 99417. Okay, so prolonged services of less than 15 minutes should not be reported. Yes, so for 99205 there is a time range from 60 to 74. During this range we cannot report 99417. If the time is beyond 74 minutes, then we can use 1 unit of 99417. So the same they are saying. Okay, the appropriate primary code will be only 99205 for the new patient and 99215 for established patient. So codes for prolonged services 99358 and 99359 should not be used with the code 99417 on the same date of service. So these codes are not applicable for the same date of service. Okay, yes, so going to the next concept. So prolonged clinical staff services with physician or other qualified healthcare professional supervision. So this I agree. So these are not a common scenario, and we are not going to code this code very often. But still, we need to remember about these particular codes. So when we can use these particular codes, when there is a prolonged service performed by clinical staff under the professional supervision, then we can report. So 99415 prolonged clinical staff service. So 99417 is related to the physician prolonged service, 99415 related to the clinical staff service. So the service beyond the typical service time during an evaluation and management service in the office or outpatient setting. So direct patient contact with physician. Okay, so with physician supervision, here physician is not directly involving in a patient care, but physician supervision is required to code prolonged service for clinical staff service. Okay, so for first star 99415, for each additional 30 minutes we can report 99416. Okay, so yeah, when prolonged evaluation and management service is provided in the office or outpatient setting that involves prolonged clinical staff face-to-face time beyond the typical face-to-face time of the E&M service as stated in the code description. So to assign 99205 or 99215 physician is required, and there is a specific time to assign these codes. If any time extended by physician, then that is considered as prolonged service by physician, and there is a separate code 99417. For the same service, if clinical staff is involved in the prolonged service without direct physician intervention, only physician supervision is involved. So then we can report with 99415 for first hour, and each additional 30 minutes we can report 99417. Okay, codes 99417, sorry, 415, 416 are used to report the total duration of face-to-face time spent by clinical staff on a given date, providing prolonged service in the office or other outpatient setting, even if the time spent by the clinical staff on the date is not continuous. So yes, we know that. So there is no any criteria that time should be continuous with the patient. It may be any time during the same date of service we can consider to calculate as a total time. Yes, so if not a time is continuous also, still we can consider to calculate as a total time for the clinical staff services provided during the service. Okay, time spent performing separately reported services other than the E&M service is not counted toward the prolonged service time. So what is this? So we need to re-emphasize on this statement. Time spent performing separately reported services. Yes. So now we can recollect. So any time spent by the physician or maybe the clinical staff for a separately reported services, that is not included in prolonged services time. So even that is not included in regular service time, but still we need to remember that is not considered under prolonged service as well. Okay, time spent performing separately reported services other than the E&M service is not counted toward the prolonged service time. Yes. So this is the point that we need to remember. And yes, so there is a grid for considering prolonged clinical staff service. So any time or any service which is less than 45 minutes reported by clinical staff, then that is not reported separately. Okay, 105 or more, 1 hour 45 minutes or more. We can assign 99415 into 1 and 99416 into 2 or more for each additional 30 minutes. So this is common, but only point that we need to remember, whenever there is a physician intervention in prolonged service, then we need to report 99417 for each 15 minutes. If physician is not directly involving patient care, just physician supervision is involved and clinical staff member performed a prolonged service, then there is a separate set of codes 99415 for first hour and 99416 for each additional 30 minutes that we need to remember in 2021 changes. Okay, so with this we covered the documentation changes required and code selection based on MDM and code selection based on time and the new prolonged service code and the associated prolonged service which is considered based on total time.